first question, how can you describe your typical work day?
Here or as a dietitian in the hospital?
We do both.
Yeah, both.
Yeah.
So in a hospital, dietitians tend to come in and they're assigned to certain units or floors, and they'll screen all the patients that are there to see who might be at highest risk. So, for example, might have a diet order or a disease that indicates they might be a high priority for nutrition risk. And so then they would then put those in order and then start to go see them and review their chart and see the patient, usually talk to the nurse and or the doctor to see if there's anything needed nutritionally for that patient. Like if they're not eating and they might need a tube feeding or a TPN or a special diet and they might need education or alterations to their food, and or they're not eating and they're getting malnourished and something like that. And so then they would start charting those things and communicating with the team through the chart and making any recommendations. And so that's what an inpatient dietitian would do. And so I did that for a long time. But now I'm a teacher, so I teach my classes and I hold office hours and I go to meetings and grade and things like that. Do research.
Okay, what do you love most about your job?
I like helping people, so I like sharing information with people and helping them. I think that those are important things in the healthcare field or teaching field.
Okay, next question. How long have you been teaching in this department?
Since 2000, so about 15 years.
Oh, wow.
14 years. Okay, what courses do you teach?
I teach nutrition and wellness, nutrition and metabolism, and medical nutrition therapy A and B, and occasionally advanced nutrition and metabolism.
Okay, next question is, what are the minimum qualification a person would need to be in your place?
So if it's to be a registered dietitian, which was I did before, you need an undergraduate degree and an accredited dietetics program, a supervised practice internship for 1 year, and then to pass an exam, and that's how you can become a registered dietitian nutritionist. To become a PhD and teach here, then I went back to graduate school and got my PhD in addition to those other things, and that's how I got here.
How many years did you take PhD?
My PhD took me 6 years.
6 years.
I think it could take less, but it took me 6.
Okay, and lastly, what advice would you give someone who wants to pursue a career in FACS?
So our department's Family and Consumer Sciences, and that has lots of different areas. It has family, it has apparel marketing and design, it has fashion, it has consumer studies, and it has nutrition and food and dietetics. So I'm specifically a dietetics advisor. So I'm not sure about advice for the other areas. You'd have to talk to advisors in those areas. But for dietetics, I think that if it's something you enjoy, then it's worth doing. There are certainly things that are better paid, you know. And I think nurses, doctors, and a lot of other things pay better. But if I wouldn't change it because I love it, and there's lots of avenues and different things you can do. You can work in the hospital, which is what I did and I talked about, but you can do education, you can do research, community work, outpatient work. So there's a lot of different foods work, so there's a lot of different areas you can work in as well.
All right. Thank you.
You're welcome.